A healthy lifestyle is possible. It just takes taking that first step. Hi, everyone. I'm Dr. Belinda Jordan. I'm a family medicine physician and obesity medicine specialist. We're going to be bringing back Doc Talk with Dr. J, and we're going to be doing a mini-series this month called Wellness and Weight Loss, where real people share their inspiring stories of transformation. Today, we have a very special guest who's been through an incredible weight loss journey and emerged stronger and healthier. She's going to share with us the lessons learned, the strategies that helped her succeed. Get ready for a heartwarming conversation that could be your motivation to start your own transformation. I want to welcome Selina Sanchez, not only our weight loss patient, but also our clinical manager.
Hello.
Hi, Selina. How are you doing this morning?
I'm doing great, Doc. How are you?
Doing wonderful. So, we want you to share your experience, what you've been through as far as your weight loss journey. Now, can you start by kind of maybe telling us a little bit about why you wanted to start losing weight? I mean, what was your motivating factor? What made you decide it was time?
Well, I noticed it last year in pictures during the holidays. I didn't feel good about myself. I wasn't fitting in my clothes correctly. My self-esteem just wasn't there anymore. And I just knew that I needed to change my behavior and my routine. I mean, I was going to the gym, but my food intake and other behaviors that I was doing, it wasn't
Not a healthy place.
correct. Yeah.
Yeah. Now, did you have any health issues? Was there anything as far as like any health problems that or family history that kind of worried you?
I don't have any family history, but I did notice I started getting a lot of knee pain. I did do a lot of sports back in high school, but it was just, I started noticing it started affecting me a lot more. And I just knew it was my weight. I mean, I knew it wasn't anything else. So I knew I had to change my habits.
Your habits, yeah. Well, I mean, talking about habits, I think habits is kind of the root of it all. Behaviors, kind of your self-talk, the negative self-talk that we do ourselves sometimes. What kind of things, what were behaviors that you felt you had to kind of make changes with?
It started with my clothes. I would put it on and I would just look in the mirror and it was just negative thoughts.
Negative
all
self-talk.
over.
Yeah.
And I'd get depressed. I'd be like, okay, I'm not going. And it was really affecting me because I didn't want to do anything anymore. I was just in a little, actually under like a little rock. I didn't want to be out. I didn't want to be seen.
Yeah.
So it's hard. I understand when patients come in and they tell me their stories. I understand. I totally understand them.
Yeah. And for those of you who don't know, I mean, I've had my own weight loss journey as well. Believe it or not, at some point, I weighed over 200 pounds. So, I can totally relate with that. I mean, I really can see. And I think that that's really important. When we talk to our patients, I think it's really important for us to share kind of our own personal journeys, our own personal, it gives them, I think, a little bit more way to relate to us.
Exactly.
So what about diet? Okay, I mean, like we talk about diet, and there's so many different diets that we do, and people come in here with all sorts of different diets. Some of our patients will, be on keto diet or doing Jenny Craig or doing some other, kind of funky diet. What do we need to? I mean, like, how did your diet change? Tell me what you found as the most important stuff that you needed to kind of cut out or watch.
Honestly, it was portions. It's all portions. And I like to tell the patients, everybody is not the same. Everybody is different. A keto diet is not going to work for everybody. Jenny Craig's not going to work for everybody. And that's what I like about our program, because we actually sit you down and tell you the pillars that you need, and not just like someone else, go ahead and take this diet and,
get that little paper and
it's not like that.
Follow it.
It's there's a program, and that's what they have to understand. Like, there's things that you're going to have to change. There's things that
it's one small step at a time.
Exactly. Yeah.
And that's very important because, when a patient comes to see me, if if they want that paper, that they want to go buy everything on the grocery list and they want to follow it exactly, there it is. Here it is. We have it for you. But for most people, that doesn't work. So we have to identify kind of what is your diet, what's your current diet, and kind of take that to like your diet 2.0, new and improved, And once you get to the point where that diet doesn't have any more ways to improve, then I think we hit the right diet. That's your healthy diet, wherever that ends up being.
And on my weight loss, I was eating healthy meals, but I wasn't eating the correct amount I was supposed to.
The portions.
Exactly.
Yeah. I mean, here in the U.S., our portion sizes are just 2-3 times what they should be to begin with, and we're used to that. We think that's normal,
Yeah. And I started eating a lot more, and I thought, hey, you know what? Eating more, I'm going to gain weight. Yeah. Actually, I started losing weight
because you're eating the right stuff now.
Correct. Yeah.
Yeah. What about exercise? I mean, activity is always important. And of course, like when someone's going to try to lose weight, what do doctors say? You got to go walk 5 days a week, 30 minutes a day. What was your exercise level, or what was your activity level before your journey?
I'm not going to say I'm an expert, but it was Monday through Friday. I would do upper body, lower body. I would minimal cardio because
I didn't like the cardio.
Yeah, I didn't. Yeah. But cardio, it will help with your calories, but it's not going to make you lose weight.
It's not by itself, not in and of itself.
Exactly. Yes, and that's where the food intake comes from. Your water intake, your behaviors,
your sleep.
Exactly.
Even the sleep. So one of the things that I like to kind of also stress is, exercise doesn't have to be exercise. It could just be kind of fun activities you like to do. Going hiking, going just doing things you enjoy doing, even home projects. I push that a lot with my patients. If you're going from couch potato to trying to get to the gym 5 days a week, it's just not going to happen.
Yeah, gardening.
I was pulling weeds yesterday, so I came in quite. It was a workout. But yeah, now what does your exercise look like now? What changed? Did your frequency change, or just the type of exercise?
Actually, what I was doing before, I was there for 2 hours, thinking, I need to be there for 2 hours to lose the weight that that I had. No, you should only be there 30 minutes to an hour if you're doing the correct exercises.
If you're doing the right stuff,
that's all you need.
Yeah.
Of course, you want to put in cardio. Go ahead.
I think one of the best type, and I think it's becoming more popular, the HIIT, kind of the high interval, high interval intensity training. I think those kind of combine the cardio and anything that combines cardio and weight resistance, I think is a good type of exercise to choose from.
Actually, I tried the yoga works, the hot works, I think.
Oh, yeah.
That was awesome. I actually don't sweat, and of course you're in a sauna.
Yeah.
But you're doing these exercises, you're learning how to maneuver your body a certain way. It's an awesome experience, and you don't have to be at the gym, like you said.
Right.
Outdoors, yoga.
Yeah, one of my friends has a program, Irma Burr, she does yoga in the park, and I think she does them every Saturday. I think yoga and Pilates are way underrated as far as, the benefits that you can get from that.
Oh yeah, I know.
So, I love,
I died the next day.
Those things. Yeah. Now let's talk about behaviors again, because, you had that issue with the self-esteem and kind of negative self-talk. And, behaviors have to change if you plan to keep the weight off. You can't just do diet and exercise, lose the weight. You got to have a plan for afterwards. How you're going to keep it off, what's going to happen then. And I think that's where behaviors comes in the most. And whether it's that negative self-talk, or whether it's more like dealing with how you deal with cravings, how you deal with, with certain behaviors, negative behaviors. I think that's got to change. Behavior modification is a big part of our program. How has your behaviors or your negative self-talk, how has that changed with your weight loss?
It has changed a lot. I do have my bad days, but, taking the bad snacks out of the house.
Environment.
Exactly. Yes, surrounding yourself around, the good things you're supposed to be intaking and stuff. My water intake, I bought a 1 gallon.
I see that every day.
1 gallon jug. now I can't be away from that thing. And when I don't have it or I miss it or forget it at home, I feel lost.
Yeah.
Like I need to have that. And it's good. That motivates me to, hey, you know what? You're still doing your goal. Like
you're getting there. You're
exactly.
Getting there. One step at a time.
Mm-hmm.
Yeah.
And I always tell the patients, like, don't be hard on yourself. Everybody comes from different areas of their weight loss journey. Yeah. But I really feel it comes from you. Yeah. If you don't want to change, it's going to be hard.
Now, one thing I see a lot is like people focus on the number. Yes. The weight, the number. And that's going to fluctuate. I mean, it's going to fluctuate day by day, morning to night, week by week. Your body kind of has this set point. It wants to keep you at your same weight. So it's going to fight you as you start to lose weight. And people may not know that the more you lose weight, the harder it is to lose even further because your metabolism changes.
Yes, exactly.
So we talked a little bit about this before, about numbers, and the number on the scale is one number, but what other numbers do you feel like we ought to be looking at, or what other ways of, what other measures are there for success?
I mean, there's multiple ones. The measurements of your whole, the body, your BMI. Actually, it comes from your blood work, your cholesterol,
those are other numbers. Yeah.
I know, if you start losing weight and get to your goal, those numbers are going to be changing. I mean, it happened to me. We did my blood work last year. We did it again to this coming year or this year. And you were like, look how much it changed. And I was like, wow, it
makes a difference. It makes a difference. And sometimes I think we need to set goals that are not just about a number, Sure. I mean, like, I think numbers besides the weight, like, maybe size, I want to be in this size, and that may not correlate with the number on the scale, but even further than that, just goals like how many number of steps you can climb without feeling out of breath, or number of miles you can walk without, dying, I think those kind of things are also important.
Yeah.
Okay. So, it's almost impossible sometimes to like reach a goal, especially like a weight loss goal, without using some kind of help.
Yeah.
And whenever we hear that, I mean, like, people come to us all the time and they want like the help they want, the tool they want to use is medication, some kind of medication. I always stress that there's more than just medication to use as a tool. I mean, your gym is a tool for you, right? Maybe a personal trainer, meal prep company, I mean, there's lots of different tools you can use to help you reach your weight loss goal. What kind of tools have you used to help you on your journey?
On my journey, I actually, I did it by myself for a little bit. Then I hit a plateau and I was like, hey, I'm killing myself trying to get where I want to be, and I'm not getting there. So I did start getting on the semaglutide weekly injection. I was only on there about 4 months within my year weight loss journey, and it actually helped. But at the same time, this is not a magic injection where, I'm going to sit back and wait for my numbers to drop.
It's become very popular now, and there's a lot of negative talk against it, and some of this I actually agree with. Semaglutide is not for everyone. Number one,
exactly.
I mean, you've got to be a right candidate for it.
Yes.
And people who are just getting it on their own and kind of using it on their own, I just don't think that's safe to begin with. But even then, you have to have a plan. You cannot use, like you said, kind of a shot to help you lose weight.
Yeah.
And then afterwards, what's going to happen when you stop using it. So how did the semaglutide help you? I mean, what did it help you accomplish?
Actually, I feel like the semaglutide, it really changed me because I couldn't eat the way I used to. And that right there showed me, hey, change those behaviors on your food intake, the portions. I started eating the way I was supposed to eat. I felt better.
Were you surprised at first, like how small your meals became?
Yes. I felt like it was bad, but good at the same time, because I was like, hey, like,
I mean,
it's
really,
still here.
That is a proper portion. It's just most of us don't even realize that is the proper portion.
And that's what's wrong with the society. Like, it's just, it's I feel like it's very hard now because a lot of women put this figure out where you're supposed to be, how you're supposed to be, how you're supposed to look. And it makes it hard for, the ones that are trying to actually lose the weight and do it the right way.
But it's so much more than just how you look.
Exactly.
I mean we have to realize it's how you feel, you know, and you may be a healthy, you know, feel great, feel wonderful numbers, and you may not look like that typical person that's skinny and, you know.
And that's when the behaviors come in, because I was doing that to myself. I would go at the gym, I'd be killing myself working out, but then I'd look at another girl, hey, I want to look like that, like I don't look like that, and then that's when I would.
And you may have been healthier than that person, you know, and doing it the correct way, you know, even so
behaviors that's one big factor. It's mental, it's mentally
number one.
It's a lot.
Now, what non-medical tools do you use besides, you know, do you use anything to help you, like measure food, or do you use like personal trainers? Do you use any other type of tools that are non-medical?
I don't use any trainers. I don't use, actually don't measure my food. I mean, I just feel like, hey, you get that portion, you feel full? Okay, stop. Listen to yourself.
To push away.
Exactly. I do take my omegas. I do take my vitamin D, my proper blood work. You know, I just keep staying updated on myself. I mean, I don't want to fall back and go back to where I was.
Old habits.
Yes.
Yeah. Well, you've done wonderful. I mean, can you share with us how much weight you were able to lose in your journey?
Yeah. Last year I was weighing about 180. Right there showed me, hey, you know, I'm 5'1". That's overweight, I know.
But you've always been a beautiful woman. I mean, like you've always carried it so well. I mean, I think health-wise is where I was worried.
Yeah. When I saw those numbers, it was just, that was too much. So now I'm down to, at least I fluctuate from like 139, 140. I have my days where, you know, I want to eat Burger King, Whataburger.
Yeah, and that's okay. I think it's all about moderation. It's about how often and portion size, like you said, you know. I don't think that you have to limit yourself 100% from any one given thing, you know. But I think you've done a wonderful job. And, you know, I congratulate you on where you've made it to and your success so far. You know.
Thanks.
A huge thank you to Selina for her openness and for sharing her incredible journey with us. Remember, change is possible, and sometimes it takes making that first step. Until next time, may you find the strength to embark on your own journey in health and wellness. Until next time.